Thank you so much, sir, for those really, really kind words. I think more than anything, the strength of our institution is all of you, the doctors, because I can see from the last couple of years of being on board that all of you doctors are not just here for practice, but then with the purpose to give back to help the neediest or the poorest of the poor in their health battles. So thank you so much to all of you for your service and for caring for those who need it the most. I just had a few words that I wanted to share, and I really feel proud that I'm representing the Board of Trustees today, in a sense, and was quite surprised actually that I'm the only woman on the Board of Trustees. And I feel like, contextually, it's so important for me. That's why that I'm here at the Gynecological Oncology workshop today. And more importantly, I think this topic is really, really close to my heart because I think what we're seeing today, what we're discussing today, has such a direct impact on women's health, especially those who are already suffering. And I think we're also talking at a time that this issue is becoming bigger. So just a couple of days back on late Shantha Kumari Garu's birthday, I was here, I was distributing some fruits to patients. I couldn't help noticing, and I think Dr. Subramaneyswara Rao must remember that I discussed with them that most patients, actually a significant majority of them, were women, and many of them, were suffering with gynecological issues. I was shocked to see that, and I think this is contextually the right time that we're discussing about advancements or experience sharing when it comes to their issues. And I think, we all know how big this issue is. The gynecological cancers, they represent a major threat and they significantly contribute to the burden of cancer among women. I think this is among the top four largest contributors of cancer among women. And in India alone, I think every year the numbers keep changing. Lakhs and lakhs of new cases get reported, cervical being the biggest. And several others, also growing in terms of numbers. And these cancers and their associated treatments are specific in terms of their medical impact and are also, I think, not specific in terms of other impacts that they have on the patients themselves and their families, right? So, they go through a lot of, the women go through a lot of transformations when it comes to their lifestyle, body image, in terms of their intimacy with their partner and their loved ones, in terms of fertility, which is a huge, huge, huge psychological issue. Social interactions, in some places, these kinds of things are still not discussed openly, and it is a taboo. And they suffer economically, psychologically, physically, tremendously. And we all know that if a woman in the family who wears so many different hats, and I see many women over here, suffer, it's not just the family, but the community also that significantly suffers. And that's another reason why it's close to my heart. And I see that I'm not just saying this theoretically, I'm saying this from a practical experience. In my work, when I go down to the villages, so I run a dairy company, when I go down to villages and I see a lot of dairy activities, they're all carried out by women in the farms. They take care of the animals, cattle, their feed, their hygiene, their health, and all of it. And once the woman undergoes some stress, some burden, some health issue, I see that immediately the family breaks down because an important source of income breaks down for them. Husbands are lost, children are lost, education, financial independence to be able to spend on the most important things such as education and health, all that goes out of whack. So, the burden on the family is so huge, the burden on the community is so huge if women suffer. So I feel that hence it's our responsibility not to just be sharing what we're sharing today in terms of technological advancements, robotic surgeries and the new crafts of the game, but also to go out there and spread awareness of the importance of discussing this issue and getting diagnosed, getting screened, and also actually preventing this, because vaccines play a huge role. We actually have a preventive solution today. when it comes to gynecological issues. And I would like to thank Subramaneyswara Rao Garu, Dr. Subramaneyswara Rao Garu, and Medical Director, and all of our surgical team for putting this fantastic, important event and for demonstrating live. I was surprised to see how clearly things were being shown, right? Seeing is believing. And it further reiterated my belief that robotics and technology will play a very important role. And in today's fast-paced world, I believe technology, you have to adopt technology in order to move forward. And I think I come from that belief, that culture, that family, where we believe technology for change is really important and is really powerful. And more specifically, I believe we are in a great place as a nation to adopt technology, to leapfrog when it comes to technology. So I'm really, really happy, delighted, and thrilled to be seeing what I saw so far today. And also, I'm really happy to be seeing that a lot of doctors here are alumnus of our own institute who are really passionately here to give back to the society. And so are the other doctors who are joining us today from various other institutes, very passionate about this. And this whole culture of collaborating, sharing, caring for each other for a better tomorrow is something that really inspires me. I almost feel that this is something that's missing in most other industries, including the dairy industry. And I wish and I'm inspired to do something about it going forward. And while, like I said, while I appreciate all members for conducting this and all of the sharing, I would also encourage all of you to go out and spread the word out there, build awareness about the importance of prevention, about the importance of screening, regular screening, and also about the importance of early treatment, which is especially missing in rural areas. I'm going out of this event inspired to actually work towards that cause, and I think that's something that's very important. And of course, as an institute, really passionate about what we're doing over here. I think I'm the kind of purpose, and most of you are the kind of people who are driven by a sense of purpose. And I feel like had I not had the background of having a family business driven by purpose, I would have been a doctor, because I'm really passionate about health and nutrition. So I think purpose is something that drives us as an institution and each and every one of us, and that's something that I'm really happy about. And our vision is to provide equitable, high quality cancer care to anyone who comes to our hospital. It could be an Arogeshri patient, it could be a poor patient, it could be a regular paying patient. I think the kind of quality of care that we want to offer to all of them is the same. They will be treated the same medically and otherwise as well. And that's what we're making rapid strides towards. And again, it is a very special year for us. It's a silver jubilee year for us, 25 years of BTR. I think that's a big achievement. So a huge round of applause to all of you for contributing towards that. All of the doctors, all of the management. I think CEO sir is not here, but then the management, the board of trustees, many of who have been with the institute since the beginning and have been supporting us. They've been cheerleaders. And then the nursing department, madam does a fantastic job of helping manage that and several other things, Kalpana madam, and the support staff, etc. I think all of you drive the institute, and it is an institute in the true sense. It's not an individual-driven kind of organization. It's a people-driven organization. And going back to why we're here today, I think I strongly believe that gynecological oncology should be an important focus area. Not only because it can be more deadly and it can be more complicated, but also because it uniquely combines cancer care with issues such as fertility and intimacy and several other things that I spoke about, which are societal in nature. So I think investing in this area not only saves lives but also preserves the quality of life of not just the woman but also the family and the community. Thank you once again, and it's such a delight to be here. I'm so glad I could make it, and I'm honored to be invited. Thank you so much.